Today, Kansas lawmakers will consider a bill allowing organ donors to specify whether they want their organs to go to patients within the state or not. It's called the Kansas Donor Rights Act. University of Kansas Health System is leading the push to make it a reality. Abigail James is live there now, and she talked with patients and doctors. Abby, what did they have to say?
Yeah, well, in the Midwest, we have some of the highest organ donation rates in the country. And because of that, we'll get the short end of the stick. That's because come April 30th, new rules for how organs will be matched with patients will go into effect. Now, for years, organs have been distributed within regions. We're Region 8, which includes Missouri, Kansas, Colorado, Iowa, Nebraska, and Wyoming. The regional system worked well for states like these because donor rates are so high, though it worked less well in states such as California or New York, where the donation of organs are low. Because of this, lawsuits were filed saying geography shouldn't matter, and that's when the push for broader sharing began, which then led to these new rules. However, doctors say these new rules could make it so patients in our area would have to wait even longer for a transplant. In today's hearing, doctors say they'll be pushing the argument that an organ donation is a personal gift, not a commodity. According to transplant surgeon at the University of Kansas Hospital, Tim Schmidt, local should be a priority.
The survival after transplant should be a priority, and cost is a big impact. I mean, we shouldn't, in this day and age of cost containment in healthcare, we shouldn't change something that increases the cost of transplant 50 or 100%.
Now, the new plan creates a sharing circle around transplant centers, and it sounds local, but coming up in just 30 minutes, we'll explain the reality. For now, reporting live, Abigail James, KCTV5 News.
And UNOS tells us a large part of local organ transplant surgeries are done with organ donations from a different state. Last year, less than 40% of donors were Kansas residents.